Have you ever felt a burning pain on the skin, followed by a rash that looks like a belt of fire? You have probably heard of shingles. Its medical name is Herpes Zoster. Subscribe, comment, Integrative Medicine Soledad del Prado. It is not just a skin problem, it is an internal battle between your immune system and a virus that has been dormant inside you for decades. Today we are going to unravel what it is, how it acts, why it hurts so much and, most importantly, how modern science and the ancestral wisdom of herbs can work together to fight it. Welcome to Integrative Medicine, where we unite scientific evidence with a holistic vision. I am Anbose. What is it and what is the virus? Everything begins with a single culprit, the varicella-zoster virus, VZV, also known as human herpes. This virus has a double life. The first phase, chickenpox when you are a child, this virus causes chickenpox. Once you recover, the virus does not disappear. The second phase, latency, the virus travels through your nerves until it hides in the nerve ganglia, near your spinal cord. There it remains asleep or latent, sometimes for 50 or 60 years. Herpes zoster occurs when that virus awakens. It is not a new infection you caught from someone, it is your own internal virus reactivating because your defenses let their guard down. Physiology and reactivation. Why does the sleeping dragon awaken? The key is cellular immunity. While your T lymphocytes, the soldiers of your immune system, are strong, they keep the virus silenced. But with age, especially after 50, chronic stress, diseases or medications that lower defenses, that surveillance fails. The virus leaves the ganglion, travels rapidly through the nerve to the skin and begins to replicate, destroying cells and causing inflammation. This explains why pain usually appears before the blisters. The nerve is already being attacked from the inside. Transmission and contagion. Here is an important myth to clarify. You cannot transmit herpes zoster to anyone. However, you can transmit the varicella-zoster virus. How? Through direct contact with the fluid of open blisters. In rare cases, through airborne transmission if the rash is very extensive. What happens to the other person? If they never had chickenpox or were not vaccinated, they will develop chickenpox, not zoster. When is it dangerous? From the moment blisters appear until dry scabs form. Once there is a scab, there is no longer contagion. Warning: keep distance from pregnant women, newborns, and people with weak immune systems until your lesions dry. Symptoms and neurological complications. Symptoms follow a classic pattern. Pain phase: pain, burning, tingling or itching on one side of the body, with no visible rash yet. Eruptive phase: red spots appear that turn into fluid-filled blisters, grouped in the shape of a band or belt. It rarely crosses the midline of the body. Complications: the greatest risk is not the skin, but nerve damage. Postherpetic neuralgia: pain that persists for months or years after the skin heals. It is severe neuropathic pain, like electric shocks. Ramsay-Hunt syndrome: if it affects the facial nerve, it can cause facial paralysis and hearing loss. Visual problems: if it affects the eye, ophthalmic zoster, it can cause temporary or permanent blindness. Western treatment and pain management. Western medicine acts quickly and is crucial in the first 72 hours. Antivirals, drugs such as acyclovir, valacyclovir or famciclovir. They stop viral replication, reduce the duration of the outbreak and decrease the risk of chronic pain. Pain management. For acute pain, common analgesics. For nerve pain, specific medications such as gabapentin or pregabalin are used, and sometimes tricyclic antidepressants that modulate pain signals. Topicals: lidocaine patches or capsaicin creams to numb the area. But, can we add something more from nature to enhance recovery? Chinese and Western herbs. Longdan Xiegan Tang. Images of melissa, echinacea, and licorice. Traditional Chinese medicine, TCM, sees herpes zoster as an excess of liver fire and toxic damp heat erupting on the skin. Treatment seeks to drain that fire and clear toxicity. The master formula, Long Dan Xiegan Tang. There is a classical formula called Long Dan Xiegan Tang, gentiana decoction to drain liver fire. What is it for? It is powerful for clearing damp heat from the liver and gallbladder meridian. Evidence. Clinical studies in China have shown that, when combined with Western antivirals, this formula significantly reduces the healing time of lesions, decreases the intensity of acute pain and prevents postherpetic neuralgia better than antivirals alone. Note: this formula is very cold and draining. It must be prescribed by a professional, as it is not suitable for all constitutional types nor for prolonged use. Complementary Western herbs. We can add allies from Western phytotherapy with proven antiviral and anti-inflammatory properties. Melissa officinalis, lemon balm contains polyphenols that block viral entry into cells. It can be used as tea or topical cream on lesions, if they are not open, to reduce viral replication. Echinacea purpurea stimulates the innate immune response, helping the body create a barrier against viral expansion. Licorice, Glycyrrhiza glabra has potent anti-inflammatory and direct antiviral effects against VZV. Precaution: do not use excessively if you have hypertension. L-lysine, an essential amino acid that competes with arginine, which the virus needs to replicate, helping to slow the outbreak. Synergy, imagine antivirals as the firefighters who put out the main fire, and herbs as the team that clears the debris, strengthens defenses, and calms residual inflammation. Prevention. Lifestyle. Maintaining a strong immune system is vital. Sleep well, manage stress. Stress is the great activator of the virus, and follow a diet rich in antioxidants. Conclusion. Herpes zoster is a signal that our body needs balance. With early antiviral treatment, proper pain management and intelligent support from herbs such as Long Dan Xiegan Tang and Melissa, we can overcome this outbreak and minimize its sequelae. Remember, the information in this video is educational. If you suspect you have zoster, go to your doctor immediately. Time is gold to prevent chronic pain. And if you wish to explore treatments with Chinese herbs, seek a certified specialist in phytotherapy. If you liked this video and want to learn more about how to unite ancient wisdom with modern science, subscribe to our channel. See you in the next video.